Hi everyone, this is Rachel Kemp. I'm here to give you an overview of my project, the use of the balanced scorecard within the healthcare industry to transform patient outcomes, a new focus on patient satisfaction. So to provide a brief overview of the balanced scorecard, it was first introduced in 1992 by Robert Kaplan and David Norton to supplement traditional financial metrics with criteria that focused on the perspective of the customer, internal business processes, and learning and growth. Because previously, companies really focused on short-term financial measures, which left a gap between the development of a strategy and its supplemental implementation. And so they laid out 4 stages implementing the balanced scorecard, and it's displayed on the right. And it really starts with translating that vision and getting consensus of where the business is going, and then communicating it throughout the business at all levels, and then doing some business planning so that you're allocating your resources to be aligned with your strategy. And then lastly, taking a look back and seeing how you're doing and iterating the process. So to provide an overview of how the healthcare industry has adopted the balanced scorecard, it was first documented in 1998 that the Ontario Hospital Associate adopted the balanced scorecard to evaluate the performance of their 89 regional hospitals. And since then, it's been widely adopted throughout the industry. A study in 2012 referenced that the balanced scorecard is being used throughout the industry, and such as places like hospitals, healthcare systems, long-term care, mental health centers, pharmaceutical care, and health insurance companies. But this early adoption of the balanced scorecard really focused on patient safety metrics and cost metrics such as throughput rates and wait times. Recent policy changes have changed the landscape for the healthcare industry. So in 2010, the Affordable Care Act, or ACA, changed the model from a fee-for-service to a fee-for-value, putting a new focus on patient outcomes. In 2011, on top of that, the Center for Medicare and Medicaid Services established an incentive program for doctors' offices and hospitals to switch from paper records to electronic medical records, or EMRs. And then lastly, in 2012, the ACA established an additional act which allowed accountable care organizations, or ACOs, to share in the cost savings generated by the delivery of care to Medicaid patients if they met certain quality standards, reported on those quality and cost metrics, agreed to be accountable for the overall care of their Medicaid patients, and also created processes around that evidence-based medicine. So back to the focus on patient outcomes. Current solutions to modified balanced scorecards since recent policy changes have been related to organizations starting to use patient survey information, such as the Hospital Consumer Assessment of Healthcare Providers and Systems, to find opportunities where they can improve. And one might think patient satisfaction might not be tied to improved outcomes, but there's been multiple studies where patient satisfaction scores are actually tied to lower mortality rates and decreased infection rates. Additionally, the largest contributor to patient satisfaction was found to be employee, whether this be a nurse in a hospital setting or just an employee at a healthcare provider, that employee communication and engagement. On the right is an example of how a company or a healthcare provider has been able to modify their balanced scorecard since these new acts have been in place to really include the patient experience, team engagement, and focus on that patient satisfaction by really engaging their team members and growing them and making sure they're satisfied at work. So when I was trying to make recommendations on how healthcare providers should modify their balanced scorecards due to new regulations, I made 2 main assumptions. First, I focused only on the U.S. healthcare industry because policy does vary throughout the world. Secondly, recent presidential election results create the potential for future changes in policy and healthcare reimbursement structures. Recommendations assume that policies remain unchanged regarding healthcare industry requirements and reimbursement structures, although that may happen in future times. So, as the climate changes due to new regulations, healthcare organizations must modify their balanced scorecards accordingly to maximize reimbursement. Continued focus on patient care and patient safety metrics such as mortality rate, infection rate, and readmission rate is vital. Additionally, though, patient satisfaction metrics such as willingness to recommend the institution and patient-employee communication should be included so that there is a patient-centric focus. Additionally, conditions affecting employee satisfaction and engagement should be included since it will be directly tied to employee engagement and thus patient satisfaction. Organizations making the change in strategy to patient-centric metrics must make this transition clear to all employees back to the implementation of their balanced scorecard. If they're going to make a big change and really focus on patients as their number one focus, they need to make this clear to all their employees so they know how they can impact these metrics. Thank you, everyone.